If you have erectile dysfunction and you start doing research on potential solutions, man, you're going to be totally confused. And the biggest strategies for this condition is all about just managing this condition. But what about fixing it? They don't really talk about that. There's just a lot of data on Viagra, different solutions. But what we're going to do is focus more on the problem, the pathophysiology, the mechanism of how this condition could occur to try to understand the root cause of this so you can resolve this condition. So many people assume that it's just low testosterone and they just need to focus on that. But there are people with normal testosterone that have erectile dysfunction. And there are people with abnormal testosterone or low testosterone and don't have erectile dysfunction. So why is that? Testosterone is part of the answer, but there's more data that I want to share with you. One of the most important molecules involved in erectile dysfunction is this thing called nitric oxide, okay? Nitric oxide, NO. Our bodies can make it. We can get it from food, but apparently nitric oxide decreases as you get older. It's at a level of 50% when you reach age 40. And nitric oxide is a major player in erections. In fact, Viagra uses certain nitric oxide pathways. And so the most likely reason for someone with erectile dysfunction has to do with a deficiency of this molecule, nitric oxide. And what I'm going to be talking about today is all the things that align with this theory, okay? Because the more data you have to back up this theory, the more it's probably true. So nitric oxide is made by your endothelial cells. That's the cells on the inside of the artery. And so nitric oxide has everything to do with helping the arteries vasodilate. In fact, it's involved in something called endothelium-derived relaxing factor, EDRF. So nitric oxide helps relax your arteries and it increases blood flow, not just with erections, but also your cardiovascular system and other systems in the body. And so if you have low nitric oxide, you could have asthma, for example. So it's intimately involved with the tone of the vascular system that relates to vasoconstriction and vasodilation. Nitric oxide increases oxygen release in your blood. And so if you don't have enough nitric oxide, you're going to have a hard time breathing. 79% of people with sleep apnea have erectile dysfunction. And so that's one connection. Another link would be the relationship between nitric oxide and cortisol. It helps to regulate cortisol, which is a stress hormone. And it's a proven fact that the more anxiety someone has, the more cortisol someone has, the more stress they have, the more they're going to experience erectile dysfunction. In fact, someone cannot get an erection when they're sympathetic dominant, where there's a lot of stress. Erections occur when you're more parasympathetic dominant, when you have low amounts of stress, when you're calm. This is why men might get an erection while they're sleeping, because they're more parasympathetic dominant. Now, here's another connection that's interesting. Nitric oxide has a profound effect over testicular steroids. This means that it helps you make testosterone. So there's your connection between nitric oxide and testosterone. If you're low in nitric oxide, you're probably not going to make as much testosterone. Nitric oxide is also involved in luteinizing hormone. That's the hormone produced by the pituitary gland that controls the testicles and the amount of testosterone you're going to make. Nitric oxide also is intimately involved in the sleep cycles, including REM sleep. This could be also why, if someone has sleeping problems, insomnia, or definitely sleep apnea, that they have a greater risk of erectile dysfunction. Nitric oxide also increases insulin sensitivity. This also explains why a diabetic who always has insulin resistance usually also has erectile dysfunction. I mean, if you think about it, what does high sugar do to the inside of your arteries? It destroys the endothelial level and thereby decreasing the amount of nitric oxide produced. People that are on statin drugs usually have either lower testosterone or they're at greater risk for erectile dysfunction. And this could be because statin drugs block cholesterol, which is a precursor for making testosterone. So the big question now is, how do you increase nitric oxide? Is there a way to do it naturally? And the answer is yes. Number one, you can start doing what's called nasal breathing. Start breathing through your nose, not your mouth. Apparently, when you do that, you increase nitric oxide. And you can also increase the release of oxygen in your blood by 20% by breathing through your nose because there's more resistance. There's actually 50% more resistance with breathing through your nose than your mouth. And apparently that increases nitric oxide to your lungs and the rest of your body. And it also helps you release oxygen. You would think you're not going to breathe as much, but you actually release more oxygen when you breathe through your nose. Now, if you combine that with number two, regular exercise. So let's say, for example, you're going to do a mild exercise where you're doing some type of exercise where you're not breathing intensively. If you can breathe through your nose, you will then increase nitric oxide. And exercise improves your endothelial cells in your vascular system, which will then improve nitric oxide. Now, you can also increase nitrates from foods to improve nitric oxide, okay? The foods that are high in nitrates would be beets, okay? Spinach, kale, any of the leafy greens. Those are all high in nitrates and will help you increase nitric oxide. Now, of course, on the flip side, you would want to avoid sugar because that destroys the inside of the arteries. You would want to avoid alcohol too, because that also decreases nitric oxide. You'd also want to try to keep your stress low because stress can inhibit nitric oxide as well. And number five, do things to improve your sleep. Okay, that's going to help increase your nitric oxide. So these are five natural things you can do to overcome the decrease of nitric oxide which comes from aging. Now, there's another video. If you have not seen this video, it's about a breathing technique that relates to nasal breathing, but it gives you a little more data. It's actually very, very important, especially if you want to reduce cortisol, stress levels, and even a panic attack. So check this out. I put it right here.